Kisiizi has had such an important relationship working with other institutions, particularly the counties of Chester in the United Kingdom. This has resulted into a long-term relationship, but also being driven by trust, sharing mission and objectives, and respect for each other. This, in a way, has also helped us to work as a catalyst in how we improve our services of serving the rural poor. Mine is a testimony, having been sponsored through the Commonwealth, and then went to the UK to benchmark and also learn from our colleagues in the United Kingdom. It also helped us to change on our organizational culture, but also a strategy of change management that has resulted into positive health outputs in serving this part of the country.
One of the advantages of a twinning partnership is that it can be customized to fit with the two institutions in the relationship. And for example, Kisiizi has the oldest and probably the largest community health insurance scheme in Uganda. We currently have just over 45,000 beneficiaries in 220 community groups up to 60 kilometers from Kisiizi. So that strength was something that we were able to link to the partnership in terms of doing health promotion and outreach. One of the proofs of the strength of our relationship is that when the THET funding discontinued, both institutions were keen to maintain the link, and it has continued to this day, right from 2008. In fact, last week we said goodbye to a couple of visitors from Chester, a sonographer and a radiographer, and their 2 weeks here in Kisiizi was very fruitful and really useful. And I think the visitors who've come from Chester have also gained quite a lot, because they've seen how it's possible to do a lot of things with relatively limited resources. Now, the success of this relationship has also drawn in other people and other groups. For example, we developed a link with the University of Chester, who have participated in some training over the years. And then we developed a very fruitful partnership with the Cheshire and Wirral NHS Mental Health Trust. And that's led to us strengthening our mental health services. And we now, for example, do 3 outreach clinics a month, seeing maybe 80 to 120 patients at a time in those clinics. We've been able to recently start doing MHGAP training, that's a WHO program, involving not only healthcare workers, but also police officers, teachers, prison wardens, and so on. And we think it produces a lot of benefit in our communities.
Again, we are happy and glad that we were involved in the first wave of WHO African Partnership for Patient Safety. We benefited a lot, ranging from waste management. Now things were done properly, segregation of items, etc. But also, importantly, that we are now able to have a good practice of hand hygiene, washing of hands, particularly now in Kisiizi, we do make alcohol rub. And this has been very important for us because, like now, when you have this pandemic of this virus, it's been easy for us because we make it here, and so we haven't had challenges like other places where people are running up and down, having shortages of supplies. In this area, we benefited, and importantly, it's sustainable. It's something we shall continue doing, and we are grateful.
Now, as Moses mentioned to you, Kisiizi was in the first wave of the Africa Partnerships for Patient Safety, and that program went really well. And in fact, when we did some training in our community of the principles of hand hygiene, waste disposal, and so on, there was quite a big impact measured. And we presented that work in Geneva in 2013 and won the first prize in the Implementation Academy of the Second International Conference on Infection Control. And that led to us being involved in the surgical unit-based safety program, which was 5 hospitals in Africa looking at reducing the complications of surgery. And that work was subsequently published on the WHO international website and hopefully has benefited patients right across the continent. Following that, we were also asked to take part in a learning laboratory in Geneva looking at universal health coverage and its relation to patient safety and quality. That led to a paper with a number of key principles. And when we came back to Kisiizi, we realised that the real challenge is not so much drawing up the principles, but implementation. And one of the practical steps we've taken to try and put into practice these principles has been the development of an IT program called Streamline. Now, this is now in 10 hospitals across Uganda, and it's rolling out to more, and it's built in and integrated patient safety features that we've learnt from this whole program. So we're quite excited about it. It has a whole range of functions. For example, there is one-click access to current evidence-based guidelines, both Uganda clinical guidelines and also WHO. Another example is the production of labels for medicines in the patient's own local language. And all these things improve day-to-day, frontline, real quality of service. Streamline also incorporates all of our insurance scheme patients in our communities, and that opens up all sorts of interesting possibilities for the future, including specific analysis of the usage of the groups and then targeted health promotion to meet those particular issues.
Again, this partnership very much helped in setting up new protocols, for example, in assessing ourselves, like a kind of having a SWOT where we had to do things differently. For example, post-operatively, it meant we're no longer giving lots of antibiotics, and this results into the cost of managing a patient much less. And in a way, this does help in the insurance scheme because the premiums are set depending on how much it costs to manage a patient. This would also mean that the insurance scheme will grow, will be sustained, and the benefits are many, and also protect the patient from, particularly in this part of the world, selling things like land, their animals, and therefore it was important that it reduces the cost and even the long stay of the patient in the hospital.
So it's been a privilege for Kisiizi to be involved in this twinning partnership, which has proved so beneficial and has had fruit not just in Kisiizi but much further beyond. For example, WHO sent a team from Ndola Hospital in Zambia to share in some of our work and to take it back to their own situation. And as we look ahead, obviously the first priority is trying to get through the coronavirus pandemic, which is beginning to hit Uganda. We've got the first cases coming, and we're working very hard to prepare for that. The foundation of the twinning scheme work has really helped us with not only the alcohol-based hand rub produced locally, but also the systems that have been put in place relating to patient safety and infection control. We would recommend looking for champions in both institutions to really catalyse the progress. We would suggest looking at the archived resources of the Africa Partnerships for Patient Safety on the WHO website, which are still very useful as templates. We would also want to use systems like Streamline that incorporate these things into everyday frontline activity.
And so we are very grateful to THET, WHO, and our colleagues and friends in the counties of Chester who continue even today to be in partnership with us. Even when some of the projects would have closed, it's been a relationship and one family. So thank you very, very much.